let's go directly to the learning objectives of today's session. We want to see what is ostomy. Of course, you might be knowing that the main ostomies that we come across in palliative care are basically tracheostomy and colostomy. So we will focus our discussion for today on these two stomy. Okay. Plus, we will see how to take care of it, what we can do, how we can help in taking care of the peristomal skin for patient because it comes very irritable many times, and also about the colostomy irrigation, right? Okay. So, why we want to be a palliative care team member? Right? So we are here to save life and we will have to promote the quality. That would be our sole mode of care, the palliative field, right? Okay, and we will also have the relatives, not only the patient, right? Uh, Unlike the routine medical care, we will be taking along the relatives also. So, if we want to give good care in nursing care, this particular approach, known as comfort approach, it gives very clear direction how we can alleviate suffering of the patient and also the relatives. Right? So, communication. Without communication, it will be very difficult to identify the problems, and plus we should be good listeners. We are not here to just to give answers, right? We also need to feel the pain that is felt by the patient. Okay, so empathy is very important in our care, uh, whichever care we are giving to patient. Okay, observation, keen observation. Many times our patients may not be able to tell us everything, right? But looking at the patient, we need to identify many a times many problems, untold stories, right? That remains behind the curtains. Okay, so our keen observation will help in doing so. Mindfulness, again, very important. Many times we do give care, holistic care to the patients, but what about our own health issues? Okay, so we need to focus on our own health also, along with the patients. Okay, family support is also very essential. So most of the our patients become very, you can say, fragile, right, because of their illness, right? And if they have positively impacting relatives, it will make a very big difference in their quality of life. So need to get family support as well. There are many openings in the field also. We need to see to it how we can help, right? That adjustment of, say, trivial things like making small dressing packs at home or giving care, making certain basic solutions like normal salines. And plus, there are many other areas also where we need to focus. Okay, so openings are vast. That thing may be very small, but it will make a major difference in patient's life. Okay, both in the health wise also and economically also. Right, so we should be ready for such things and always open for the for training. So that's very nice of you to join this course. Relating factors which affect care, right? There may be many things which are affecting the total care of the patient. So need to identify. So if we have good communication practice, we can always reach out to people. And as nurses, we are the center who will connect the patient with other. It is palliative care is multidisciplinary care, right? So we need to connect with others also, right? In basically to alleviate the suffering. So that R is also very important. And this team approach again. So that is the main factor. Okay, so let us move to further. What is ostomy? You know, by definition, it is any artificial opening that is made into the body. Okay. What are the types? So basically, there are two types. One is input ostomy and another one is output ostomy. So here are some of the uh, examples of input ostomy, right? So tracheostomy, gastrostomy, feeding jejunostomy. Okay, and we as nurses are uh, liable to take care of these things, right? And also because the patients are not going to stay always with us in the hospital, they will be liking to stay at home, right? So home-based care, how to give, and the relatives, how they can help in patient care. So we need to not only teach the patients, but also the caretakers. Output ostomy examples are like colostomy, urostomy, ileostomy. So today we are going to focus on tracheostomy and colostomy. Uh, these phases are also very important. Of course, it is true for all the types of interventional procedure, but sooner the patient understands and adapts to his situation, the better, right? So first of all, to start with, patient may be in shock right at the time when the news are disclosed to him that he is having malignancy or he is going to deteriorate day by day, right, because of his chronic illness. It may be anything. Okay, so he may end up in shock and panic, right? Then he is going to defend himself. Caretakers are also going to defend themselves that this should not have happened. We have taken enough care, he landed into this situation. And denial also, right? They are going to have many questions in their minds, okay, which we are supposed to answer. uh, Many times in nursing we learned that okay, the diagnosis should be made available to the patient and the caretakers by the doctors only, right? But here in palliative care settings, it is not so. Whoever is good in communication generally breaks the bad news even. Okay, so that's why, as we saw in the previous slide, communication is very, very important. uh, then slowly the patient acknowledges that whatever he is having, it's true, right? Now he adapts the situation, yeah, and he makes adjustment with the life, right? And the diagnosis is going to turn his life upside down, right? Many a times it is very difficult to answer all his questions. Okay? But as far as possible, we should try at least. And if we are not able to do, then not to shy away, to say no. And we can try to find out the possible answers and make others also involved. Okay, so taking help from others is not a fault, or it we are not. It is not like that we are not knowing the subject. Okay, so always be ready to involve others wherever possible, because ultimate goal is to give comfort to the patient. Right. So assessment of needs is very important. I know this four circles you have seen many a times in your studies, right? And one more person is also added here. You can see in the center circle, right? Patient is not alone. His family is also involved. And no, none of the circle you can take away, right? All these circles are interwoven so closely that if we omit one circle, then we cannot provide the care of the content in the second circle. Okay, so we should always remember all this. Look at the patient and the family from all these angles. It may be his routine daily care, or it may be nutritional needs of the patient. There may be difficulties in communication, right? Whether patient and the caretaker are isolated, right? Society have kept them aside or whatever reason, right? So communication is going to help us a lot, and we need to assist them in all these issues. Okay. So what so physical problems, identify what is location of the wound, what is the size of the stoma, right? Or if the patient is having wound on other parts also, whether there is any kind of exudate or not. If yes, then what is the level, type, order, all these things are very important. Right? Frequency of the dressing change, whether patient is having pain during this procedure or not, right? Whether it is comfortable or not, whether any infection has taken place or not, because our next step will depending on the whatever assessment we do, right? What is the pain level, right? So we should know how to assess pain also, right? And I'm sure you must have learned in quite detail about it. Peristomal skin condition, because it is going to matter a lot, uh, because of the pruritus, presence of pruritus, and whether the most problematic thing in the patient's social life, whether this wound, whatever the patient is having, right, or you can say stoma that patient is having on his body or her body, is affecting the daily activities or not. Okay, because unless he has good, he's independently whatever he can do, he will feel very comfortable. And the day he becomes dependent on the other person, maybe family member, right? But it hurts him a lot, right? So always identify whether it is affecting the daily living. First, we will focus on the tracheostomy care. Yeah. So uh, will the patient will look like this, and after tracheostomy there are, because the opening is made right into the trachea, right, the anatomy and physiology changes, right? There will be we know the function of normal trachea, like what it does, it helps in the humidifying. It has secretion also that should remain normal consistency, right? But because we make opening, what happens now, it will dry off, okay, and the secretions may become thicker, okay. Then infection will very easily take place, right? Patient will have lot of difficulty in communication, especially in the beginning. Then uh, patient, the one of the function is to get smell of the food, right, and any other smell, right, and it will also help in the taste, right? So that also patient is going to lose, right? So it you can say meal times will be very difficult for these patients. So how to go about it, that we will learn. So what patients will complain or carers will complain us are basically cough, right? Because it is constantly irritating, right? The air which is going in. Then conditions are becoming very thick, right? Then communication problems, of course, will be there. Eating and nutrition, patient may reduce taking intake. Consistency of food will also make a lot of difference. And of course, the body image concern. So we should apprehend the we are going to have in the patient, okay, and make the care plan accordingly. Right? Times in palliative care, we hardly make care plan. But if we know that okay, the patient is undergoing the procedure of tracheostomy, if we know certain things in advance, then we can plan better. Right? And then, if the patient tells us or the caretaker finds any other difficulties, then we can help or modify the care plan, right? So it is very essential that we have something in our mind what patient is going to face, right? And we can talk with the patient also and prepare him psychologically what is expected out of that procedure, what he will be feeling like. If we tell everything in advance, then he will be at ease and we can get good cooperation from both the persons, right? Patient as well as the caretaker. So, if we talk routine, uh, I'm sure you all have come across the various types of tracheostomy. Okay, so which type of tube is inserted in the patient's trachea? We need to understand whether it is inflated with balloon, without balloon, what kind. Okay, and of course the fixing and everything. So care will depend on these factors also, right? So if we say that patient having double tube tracheostomy, then while cleaning, what to do? It should always be clearly taught to the patient relatives and as far as possible patient himself. Encourage patients to take care of himself as far as possible. Of course, there will be many factors which will affect that. Right from the patient's willingness to learn, then whether patient's health situation is allowing him to do so or not, and so many things, right? So always instruct that only the inner tube should be removed for cleaning, not the outer tube. Okay, otherwise he is going to land up in major problem. Okay, so it should be removed. It should be clean with the normal saline. Even at home with soap and water also, mild soap can be used and it should be clean of the secretions that are lying in the inner passage under running water, right? So it becomes quite easy. Okay? And then sterilization of that should be taken place. Okay? So it can boil for 10 minutes. Okay? And then one has to reinsert with the help of the pilot. Okay? The tube plates, how to clean. Okay, so these things also should be cleaned with normal saline. We don't use any other material for cleaning of the plates. Fine. Then what about the skin care? Okay, so this when we are cleaning, one should look at the condition of the skin, whether any kind of redness is there or not, any kind of swelling is there or not, right? So that should be any secretions are there or not, right? Everything we need to find out and clean it nicely with the help of the normal saline. Okay? And we should at the same time be gentle also, not hard rubbing. Okay? Otherwise, it will uh, cause more trouble to the skin. Okay? Then after cleaning, it should be dry, and then next dressing pad should be placed. Okay, so you have to put a slit, how to do that, right? And then uh, so that there will be some gap. It is beneficial to keep one finger gap between the plate and the skin. Okay, so that it doesn't become very tight. Okay, and while tying tie also that we will see further how to do. Then how to do suction, right? So suction also the tube suction tube should go only little bit, hardly 2 inch, right? Not the full thing should go inside. Okay, so because when we are doing suctioning of the endotracheal tube and tracheostomy tube are quite different, right? And the time also should be very less, not more than 5 to 10 seconds. Okay, so that should be seen to it, and it is done only when there are copious thick secretions are present. Okay, so that should be seen. Ideally, you can encourage patient to cough up the thick secretion. That would be ideal. And how to catch in clean gauze or autoclaved gauze or autoclaved pieces of the cloth, right? So that can be done so that you don't introduce the infection in it with dirty material. Okay. Uh, when it should be done. Okay, so this is ideally advised to be done before meals so that in between meals he doesn't have problem of coughing and all. Before going to sleep so that he can have sound sleep, and if the person is going outdoors, right, so that in that environment also patient is not getting any difficulty. Okay. Then about humidification of air, right? When the natural air passage is there, it humidifies itself, right? Because of the presence of the secretion. But now it has become difficult, right? So wet sterile gauze can be placed over the tubing, okay, on top of the tube, and it will also help prevent foreign material going in. There are adapters also coming, okay, so that can also be fixed. Plus, patient should be encouraged to take lot of oral fluid, okay, minimum 2 to 3 liters. Okay, so that helps. Even steam inhalation, if you give, that also helps to humidify the air. Okay. Changing the tie. Again, patient can use mirror, okay, and then he can change the tie. Okay, so he can use dark color tie if possible, right, made out of the string cloth. So that he can do. When it is dirty, it should be, of course, changed. Okay, and as I told you, one finger gap should be there between the plate and the skin. Always educate the male patients whenever they shave. Okay, the hair should not fall in the tube. So this utmost care should be taken. And even when they clean the face, okay, not to pour water over it, okay, so that it doesn't go inside. Fine. Then about the speech, right? Slowly you can teach him. In the beginning, he may have difficulties. Yes, so he can take deep breath, then block the tube with the thumb or finger, and then try to speak. Okay. Speech therapy can also be given for the matter. Okay. And of course, there are other ways like providing the pen and pencil or sign language, right? Asking close-ended questions. So with yes and no, with nodding only, he can answer. There are pictorial cards also, so that also can be used. Right? So these things, once the patient accustomed with the procedure, he will adjust slowly. Then eating and swallowing are going to be little difficult, right? So the person can have thick liquids, and the content of the diet that is given, it should have similar thing, right? It is not like soup, right? And soup, and then you add the breadcrumbs in it. Okay, it should not be two types of consistency should not be there together. Okay, that makes the patient more problem. Right, so thick liquids can be given and soft diet in first, then slowly as he become accustomed with this tracheostomy tube, uh, and he can be given more. So he should be asked to chew well, and small bites can be given. Okay, and keep the meal times relaxed. That is very, very important. If he is tense or you are making him to eat hurriedly, then it may happen that he may aspirate. So that should not be taking place. Deflating of tube cuff will also help so that we know the anatomy and physiology of the esophagus and trachea, right? So this thing will also help. Uh, uh, for sleeping, sleeping in inclined position is a bit encouraged. Okay, and use of recliner will be beneficial for the patient, right? So it should be seen that he doesn't sleep in the prone position. If side lying also, then the neck should be little straight and all that. That should be taught to him. When to call for help. This also requires a concern. If the patient is feeling any kind of choking while eating or drinking, and if doesn't get cleared off, then he should of course seek help. uh, long time shortness of breath or cough, and along with that, if the patient is having fever, okay, that may indicate the infection. Okay, so that at that time also he should seek for medical help. If the patient is coughing up the secretions, and if you find the food particles in it, okay, then it is of course a concern to be noted and find the medical help. Any large amount of watery or discolored secretions that also need to be immediately seek help from the medical personnel. Then patient is not able to eat, patient is losing weight continuously. Okay? So such things should be noted and got attention from the related personnel. Uh, Patient is having respiratory tract infections very frequently. Okay, so that also need to be addressed. Next, let us move to colostomy. So we know what is it, right? Colostomy is a surgically created opening, okay, into the colon to bring out the stool. Okay. And there are various indications also. The patient may be having ulcerative colitis or Crohn's disease, of course, cancer of colon, if there is any obstruction, any congenital abnormalities, small babies may land up in undergoing colostomy procedure, if there is any injury or trauma, whether any fistula has come. Okay, so these are some of the indications where the patient will undergo colostomy procedure. So types and will depend on duration of time also, plus where it is placed, okay, which part of the colon is taken out on that also. Right. So basically, depending on the time, if we see, then there are temporary and permanent colostomy. Right. So temporary colostomy basically is made to give some rest to the colon. Okay. So till the healing take place, and then it will be again rediverted to the natural passage. Okay. So for that, it will done. And permanent colostomy, it will remain till the patient dies, right? So both are different. Sometimes temporary may become permanent also. So that also need to be taken care of. Okay. Uh, then depending on the site of the incision. So loop colostomy, okay, generally it is used in the case of emergencies, okay, and it may be temporary and large stoma may be there, right? So care may become little difficult also. Loop of bowel is pulled out onto the abdomen and it is held in place with the external device. Okay, so that is loop colostomy. Okay, and then the bowel is sutured to abdomen and two openings are created. Okay, in one stoma where the stool will come out, and from other the mucus will come out. Okay. Then other type is end colostomy. It is also known as Hartmann's procedure. Okay, here the stoma is created from one end of the bowel, and the other portion of the bowel is either removed or it is closed. Double barrel colostomy is also there. Uh, this is ball is severed and both the ends are brought out onto the abdomen. And but the only proximal will be found in us. Okay, and which type of patient will have? It will depend on the naturally nature of the disease. Okay, and what end result we want. Okay, so surgeon will decide onto it. Okay, what is the preference of the surgeon? It will depend on that also. Right. So let us go to colostomy care. So as we had the stages of stoma, right? In the first few slides we had seen, right? So we have to prepare the patient, right? when it is decided that okay, now stoma colostomy needs to be done, right? So the patient will have pre-operative counseling. Uh, so here also nurses play a major role, right, in teaching, right, what he will expect after the procedure. Okay, so that is there. Then stoma site marking will be done, right, depending on the reports of the patient, USG and CT scan and all that. It will be marked where it should have. Right? It is always preferable that it is created on the flat skin of the tummy. Okay, that is very, very important. Post-operative care, of course, we will be teaching to the patient and how to go about irrigation. In our place, we hardly do any irrigation, but in many centers, it is done. Basically, it helps to create a fixed time so that there will be less stool coming into collected into the stoma bag. So in that way, it helps a lot, and patient finds it very comfortable. Right? So, what are the goals of treatment? Okay. Basically, we want to give rest to the bowel, right? Control the inflammation because of which the patient is undergoing that procedure. If there is infection that we want to combat, okay, so we need to take care of it, that he is not introduced to other infections now. Cut any malnutrition, that is also very, very important. Otherwise, many times patient is not able to go into further like radiation or chemotherapy, and so malnourishment should never occur. Right? It also one of our goal will be reduce stress also, because from the moment the normal course of stool uh, is not going to be there, he comes to know that you can imagine how you feel, right, when the bag is on the abdomen. So mental stress is a lot. One, it is with the disease, and next from the such procedure also, which is going to change his lifestyle entirely. Right? And provide symptomatic relief. Of course, whatever day-to-day patient is having a difficulty, then you should be there to support him. And of course, improvement in the quality of life. Right? So these will be the goal of the treatment. So if we talk about the general care, then of course the person need to monitor how many times the movements are there. Okay, basically whenever the patient is going to eat or drink, there may be output, right? That is what is going to happen, right? So how much output is there, that also needs to be identified. And any difficulty, your relation, your IPR with the patient should be such that any problem patient is facing, he should be able to talk with you. Okay, such type of communication should be developed. Okay, so that you can encourage him for his self care, okay, and find out difficulties he is undergoing. uh, Explanation of all the procedures starting from preoperative till the patient is going home. Okay, so all those things we need to see. Then stress management, of course. Then patient needs to quit smoking. That because otherwise the healing of tissues take a very long period of time and may not heal also. Right? So one major thing is that too. Of course, the psychological support will be there. Adequate rest is also very important for patients' general well-being also. Right? Other considerations will be like involvement of the family members. Right? Habit formation is very important. How to go about all this, we will see in subsequent slides. Diet, what to take, what not to take, right? What is his occupation, right? Before the procedure, what he was doing. Okay, whether he can continue with the same or not. Most of them are able to do so, but we need to help them. Whether patient can travel or not, and if he is traveling, then what care he should take, right? How patient can what sports he can take part in, right? What type of clothing should be worn? All these things and skin care and all this we will be taking into consideration. So this is how the patient's stoma will look like. Okay, from outside what you can find and the inside what will be there. Okay, and how he will look with the colostomy bag. Fine. So as but depending on the where the stoma is created, the stool consistency will be in that way, right? So if it is in the ascending colon, right, it will be like liquid stool you will find. Then if it is in transverse position, then the stool will be mushy because some fluid has been absorbed, right? Water has been absorbed. If it is in the descending, right, it will be semi-solid. And uh, so you need to teach to the patient and relatives also in that way. They should not get frightened, right? Uh, so that is important. And these are some of the types of bags that are given here, right? So here you can see the normal stoma and how on right you can find two-piece colostomy, right? So one is wafer and over that this bag is will be fixed. Okay, so here you can see the wafer is stuck to the abdominal wall. Okay, and over that the patient will fix the colostomy bag. Okay, and this is one piece colostomy bag. Okay, so where the sticker will be right on the bag. Okay, and patient need to remove the paper and directly stick it to the abdominal wall. Okay, and this is the neck and the clip. Okay, so the person has to uh, fold it two times and then uh, fix the clip. Okay, so while how to do cleaning that we will see later. Fine. So once the patient is out of the surgery, okay, so what immediate post-op care we will be giving. Okay, so naturally we have to monitor vital signs, right? And breathing will be little shallow because of many things, right? One is because of the effects of the anesthesia, okay, and if the patient will breathe deeply, patient may have pain. Okay, so because of that also he may breathe shallow. Okay, so uh, that is seen in the patient. Then patient should be instructed how to support the site, right? While if you want him to do coughing exercise or deep breathing exercise like that. Okay, so that should be taught to him. Uh, and of course, before because the patient will have pain, right? So pain medication should be given priorly and then make the patient to do so. And fluid intake and output should be measured accurately. That is also very important. Of course, the operative side should be observed for color and amount of the drainage and all, any oozing is there or not. Right? In the beginning, there will be oozing from the peristomal side also, that is normal. But as the stoma will heal, okay, peristomal skin will heal, the peristomal secretions will also reduce. Okay, so that is same. Many times patient may come with the nasogastric tube. Okay, so if you need to do any suction, okay, so again output should be measured. Okay, uh, once the bowel activity resumes, it may be removed also, depending on patient's condition, of course. So fluids and electrolytes are given IV until patient's diet he can slowly start taking. Okay. So in the beginning, it will be liquids and then slowly advance to regular diet as it is tolerated. That in little more detail we will see. So we will maintain intake and output chart. Okay? And patient should be generally out of the bed approximately in 8 to 24 hours after the surgery. About the stoma, if we say, then stomal color should be noticed. It should be pink in color. Okay? That is important. If it becomes darker in color, then the necrosis started taking place. So that needs attention of the surgeon. Okay. Bleeding usually seen at the time of the cleaning. Okay. So slight bleeding is okay. So you can compress with dressing material for 10 minutes and it should stop. Or you can use sucralfate tablet powder. Then whether any edema is there or not. In the beginning, there may be edema in the surrounding tissues also. Slowly it will reduce and only the stoma will appear on the abdominal wall. Okay. There should not be any herniation, right? Like going in or coming out of the stoma. Okay. If there is stoma prolapse, then it can be for 1 to 1.5 centimeter above the skin level is okay. Generally in ileostomy, it comes to around 3 to 3.5 centimeter above the skin level. If prolapse is more than 5 centimeter, then one needs to be little cautious that it may not increase even more. Okay. Generally less than 5 centimeter will be managed with manual reduction, but if it goes beyond 10, then surgical intervention will be needed again. Right? So one needs to be observational very much. Regarding retraction, if no interference with the bowel movement, then no intervention is needed generally. Otherwise, surgical correction may be advised. Then, as the tissue color, we need to observe, right? So that we can come to know whether any stenosis also has taken place or not, whether stool is coming out or not regularly, the shape of the stool has changed or not, and all sorts of things we have to see to it. Peristomal skin attention is also required. What nursing problems we will find is irregular bowel action. Patient is suddenly developing obstruction or constipation, right? Then in such cases, laxatives will be used. Enema can also be given and suppository can also be placed. Whether patient is having diarrhea, right? So in such cases, you need to increase the intake of the fluids and hospitalization will be advised. See to it that because of the oozing, any kind of excoriation has taken place or not. You need to see to nails also that it should be cut and no rough edges, right? And the signs, I mean, on the skin, right? We can find out immediately whether patient is able to pass platters or not, right? Generally, the bag will become puffy. There may be odor also, so need to identify what patient had in the food. Okay, what was his intake? Okay, generally nowadays bags come with charcoal, so that takes care of it. Okay, and many times this bad odor will hinder him from going outside. Okay, so his social life is affected very much. Psychological problems will also occur, right? So we need to see to it that he has this, and of course the stricture. So let's see about the skin care, right? So it should be cleaned with mild soap and water. Okay, once the healing takes place, peristomal skin care is very, very important and it should be pet dried, okay, not with vigorous scrubbing. Okay, so that should be seen to it. Correct size of bag also needs to be used, right? And one has to instruct that empty the bag as it is 1/3 full. Okay, if we wait longer, then it may happen that with the weight, the bag will come off, right? And it will make a problem. Uh, for cleaning, either use gauze or soft cloth pieces, which he can dressing you might have learned how to make at home. Right? So soft cloths can be used, or soft napkin can also be used for cleaning and the drying of the skin. Use of antifungal powder may be useful to in case of fungal infection and prevention of it also. This caraya powder mixed with egg white will help in the excoriation also, and plus it helps to pick the bag well. Okay, so that also helps. Uh, any kind of powder or cream on the peristomal skin should be avoided. Okay. Okay, so emptying at 1/3 full, we just saw, right? Now how to empty? So he can sit on the toilet, okay, sit and then place either tissue or like that. So when he empties the bag, the material will not splash on him, right? And which side he will sit, that is as comfortable to him. It is not a problem, right? So he is facing forward or facing backward or on the sides, whatever is comfortable to him, he can sit. These are small things, right? But the patient may get very confused. Relatives also get very confused. So it should be as comfortable to the patient. Okay, so that is there because he ultimately has to take care of himself, right? After emptying of pouch, it has to be rinsed thoroughly, right? And there are different solutions also coming for rinsing, and so that there is no order also. All these solutions are very costly. I many times hear stories that the patient, one particular was telling me that he spent around 1.5 lakh for the procedure. Okay, but he is having the stoma since last 2 years, and now the materials, the cost of material has gone beyond that. Okay, so such thing can also create things, problems, and you can imagine about the poor patients. Right? So whatever is available at home, from that he has to manage. So we need to teach like that. Okay, so inside of the pouch can be sprayed with non-stick cooking oil also. Palm spray can also be done, little bit only, so that the stool doesn't stick with the inside part of the pouch, and removal will be very easy. Actual patient will look like this, and this you can see the normal stoma, how it is pink in color. So that shows us how healthy it is, right? And while cleaning and all, again here, encourage patient himself to do so, his body part, right? So he needs to clean it, right? So always place mirror in front so that he can have better view. While applying new pouch, he should be instructed to write date over it, right? So that he remembers when to change the pouch, right? Because disposable pouch also can be used multiple times, but how long, that we will see. Uh, then best time to change pouch is in the morning. So one can follow his routine pre-operatively, how he was doing. Uh, okay, so accordingly, he can be changing the pouch. Plus, he may require before eating or drinking anything. Okay, so that is also there. Stomach can function at any time. Because of this, we have to see to it that it is changed so that after eating, he doesn't land up in problem. How to apply pouch? Okay, so stand or sit while applying, right? Keep the skin wrinkle free, right? So he may have to stretch, right? That's why the incision or the creation of the stoma should be on the flat surface of the abdomen, right? That is why it is important. Then okay. If there are, you find any hair growth, then they can be trimmed off. with scissors or electric razor, but see to it that he doesn't harm himself, right? For reducing odor, uh, the food which causes gas in particular patient should be avoided. Okay, because no two patients are same. Okay, so generally broccoli, cabbage, onions, fish, and all, they cause odor, right? So that thing should be avoided, right? And similarly for gas forming food also. Mint and coriander reduces smell. Okay? And we can always place charcoal. Now the bags are coming with the charcoal powder, right? So that has less issues of odor. And cleaning it thoroughly will also be helpful. Use of deodorant can ready-made, I mean, companies provide, so that also can be used. And for the surrounding environmental, they can use any incense sticks or like that. Okay, so that is there. But not to add any kind of aspirin in the pouch, right? It may remove odor, but it will cause ulcer on the skin. Okay, so that should not be used at all. For ileostomy, one piece drainable pouch should be changed every 1 to 3 days. Okay, and of course, it will depend on the need of the patient also. And two-piece drainable pouch. Okay, so the base plate that is sticking on the abdomen should be changed twice or thrice in a week as per the need of the patient, because some patient may have oily skin, okay, and it may be coming off very fast, right? So it should stick to the skin. It should not have any harmful effects on the peristomal skin. No leakage should take place. Okay, so everything will depend on this. For colostomy, one piece pouch usually requires 1 to 3 changes a day. And for two-piece pouch system, the base plate needs to be changed every 2 to 3 times in a week for colostomy. Disposable bags can be changed every 2 to 3 days. Okay, so they should not be cleaned and dried under the skin, okay, under the sun, sorry. So that care should be taken. Because in India, such things are very costly, so they may go on reusing. Okay, but then it will have a limit of its own. The material will have its own limits. uh, Diarrhea management, how to go about it. So when the patient is changing the diet, okay, so ask him to introduce one new diet, one new menu at a time, not 2 3 things at a time. Okay, so that you can identify which food item creates problem for him. So find out first what are the stress factors, because that also can cause diarrhea, right? If patient is having any kind of medications which can cause, okay. And these three things are very common that can cause diarrhea. Then also like in general diarrhea, same here also we need to find out, differentiate diarrhea from stools, right? So characteristics of the stool is also very important. Then, if the patient takes continuously liquid diet, fruit juices, milk only, like then it is bound to create loose stools. Okay, so but it will slowly resolve it on its own also. Stress reduction technique should be taught to him. Okay, frequent small feeding will help, of course, in such things. Okay, low fiber and high protein diet consist of bland foods that are easy to digest, and it will create less GI problems. So they can be uh, advised. Infective diarrhea, of course, will need medical management. Okay, and they lose lot of electrolytes. Okay, so hydration is very important for them. This we have already seen. Also, dairy products and spicy foods will also cause problems, right? And lot of irritation also, right? So see to it that your patient which type of diet is suitable. How to manage constipation? right? So high fiber diet can increase the size of the stool also, and it can cause temporary blockage, right? So generally, it is because of inadequate water intake. Okay, so ask patient to increase the intake and soluble dietary fiber. Corns, nuts, cabbage, vegetable peeling may cause hardening of the stool, right? So small amount he can take, but see to it that does not have problems. Inactive stomach for 4 to 6 hours with abdominal cramps should be reported, okay, and medical advice should be taken. Laxatives may be prescribed. Nutritional support patient, whether he's having any parenteral nutrition is there or not, need to find out how to give about it. That also, as per the prescription and advice, we can go about. Replacement of the fluids and electrolytes are very important in these patients, and the diet should contain sufficient amount of protein, calorie, and nutrition, right, so that he can continue his treatment. And of course the iron intake, right? So these are very fast look at things, right? Identify things. Most of things we have seen in the earlier sites. This is just summary. Everyday life with colostomy, right? So like what kind of games he can play. So avoid contact games like football, cricket, basketball, where there are dashing to each other may occur. Okay, kabaddi, boxing can be avoided. Then traveling, you can say protect the stomach with the help of some bag or purse like that, right? So they can do so. Keep extra collection bag also, right? So whenever they are traveling, they can have in one small container, they can place everything, whatever is needed, and then they can travel. Again, you need to see to it that they don't have close contacts with the others, right? So in rush hours and all that, it should be prevented. Then no restriction over the clothing, but they can wear loose clothes and tight, because tight belts and all will cause problems on compression on the back, and stoma and all will occur, right? So loose clothes are advised. Many times they find their own fashion, so this quite natural. Uh, so we in India hardly talk about sexual life, but the families get broken because of these life limiting things. So support of spouse is equally important. That's where our communication makes difference, right? So right advice at right time is very important. There is no restriction over the sexual life, right? Encouragement is all is required. Lot of counseling will help surely. When to call for help? So frequent leakage is there from the pouching system. Very often he's having cramps and all that, right? Discomfort, right? So any change in the stomach, herniation or stricture or like that, uh, blackening of the skin, this thing should be immediately noted by the healthcare professionals. Uh, any more rashes, such things should be. Then discharge, large amount of discharge also, or it is not functional at all for 3 days, bleeding, right? Swelling, okay? Stomach going in, okay? Then irritation, ulcers, right? Bulging, all these should be uh, informed. Certain complications also can take place, like excessive bleeding. Uh, there may be infection in the wound. Okay. Then incisional hernia can also take place. Okay. So again, resurgery may be done. Thrombophlebitis can also occur. Okay, so prevention, as we do in the uh, normal surgeries also, here also they can be advised how to prevent. And stoma narrowing. Others are like pneumonia, pulmonary embolism, medication reaction, breathing problems, right? Any obstruction of intestine again. Okay, so uh, next we will move to colostomy irrigation. So as I told in the beginning, that irrigation is also important, and some patients are, it is like they take it very naturally, okay, and in many parts it is not done also, right? So irrigation is basically done to empty the colon. Yes, so whatever natural stool is there, it will get out of the body. So there won't be much bowel movement during daytime. Okay, so if the person is going for job and all, it becomes very easy. Okay, so that's why mostly irrigation is advised. So it will look like this. Okay, you can see patient here sitting on the chair. Okay, and fluid is there. So how we can do it? Let us see. So purpose to establish regular bowel habit, as I said. Then clean, it will clear the colon of gas, mucus, and feces. Plus, it will prevent skin excoriation because there won't be any kind of leaking and all. Right? Any irritated food has gone in that can be removed. Okay, it is done once a day only. Okay, so that should be taken care of. Right? So here are the equipments. Here you can see the irrigation sleeve. Okay, so this part will fix with the stoma, and here you can see patient is sitting on the stool. He has kept the sleeve other end into the toilet seat. Okay, uh, then this is the cone which will go inside the stoma. Okay, and this is the bag. Okay, generally 1 to 1.5 liters of normal saline can be used, or very warm lukewarm water can also be used. Okay, the fluid should not be cool, otherwise it will cause lot of cramps. Okay, so just like enema, it is hung at 1.5 feet, and it will be the fluid will be passing on. Okay, so we will see how it can be done. Okay, here all the equipments are together. These are the solutions that are used in, as I told, plain water and normal saline. If enema needs to be given, then soap water enema can be given. Right? So when to start irrigation? Okay, so after the healing has taken place, generally after 3 months, it is started. Okay, and it will take around 21 days to regularize. Okay, anything you make a habit, it will take 21 days. Okay, so it will take such time not to irrigate when patient is having diarrhea. So clear instruction should be given to him, and not to irrigate at all in ileostomy. Okay, so that also need to be taken. So patient should know what kind of stoma he is having. Okay, so the funnel that we saw in the previous picture should be lubricated well, and it should not be pushed inside. Slowly it should be introduced into the stoma. Okay, amount is 1 to 1.5 liter. Okay, and it should not be very fast. Flow can be regulated with the regulator. Okay, so slowly it should go. Okay, so it will take around 15 to 20 minutes, and then patient has to wait for half an hour for the return flow. Okay, so patient also needs some time to spend in the uh, inside the toilet. Okay, so that is also there. Okay, so instruction, this irrigation can be continued lifelong. Okay, habit formation will take place after 21 days also, and irrigation at the same time. Okay, that's what previously before surgery what the patient was following, whether it was morning time or evening time. Okay, depending on that, he can do irrigation. Okay, there are many innovations also in ostomy. Okay, so basically the companies, they try to give maximum comfort to the patient. Okay, but in this course of time, what happens that many things like uh, particular stoma bag only should be used. Then they will all the other products, no, like cream for removal of the this sticker, right? Wafer also comes. So those creams you have to purchase from them, all sorts of, right? So the prices will go and budget will be out of patient's pocket, right? So it becomes very problematic. So, and many times patients and relatives, they will ask nurses also for which product they should go, right? So at that time, we should know somewhat about various innovations, what have come into market. Okay, so basically, all these do uh, give more comfort and safety to the patient. It is more for the empowerment of the patient. But the basic care, like stoma, peristomal skin, right? All these things only nurses can advise. Okay, so that's why whatever product patient may be using, right? But ultimately, basic nursing care will be same, right? So, for such things, company will not help them, right? There will be nurses only. So we should empower our nurses and make them confident that how to take care, right? Many times it is seen if the routine, I mean, natural, this stool, they will be, nurses themselves will not be giving bedpan, right? So they hardly go and give stomach care also. Such things happen, right? So it is ultimately our responsibility that we should not feel any shame, or we should not shy away from such care, right? Uh, and that's why they make the relatives and patient to take care immediately, right? But in the beginning, immediate post-op care, patient and relatives are also not comfortable. We have learned nursing procedures and all, so we may be uh, comfortable a bit, right? But patients and relatives are not knowing at all. So you cannot force them to take care right from the beginning. Okay, so as you take care of stomach, you need to involve patient and relatives, right? So that's where the difference is there. Okay. And because of the rising demand for advanced and patient-centered equipments and the solutions that are used. These things are also important for us to understand. Okay, so here are some of the innovations. So you can see here, like, right, so you can fold this and it will come over the stoma. Okay, and it will fix in a better way. Okay, so there are biocompatible adhesives that can be given. Okay, so I will go little fast because electricity has gone in my room. So may not be able to uh, go completely. Only two, three slides are remaining. Okay, so we will move fast. There are sensor-enabled pouches are also there, which can be attached to smartphone. Okay, so that is also there. So they will remind patient when to change their pouch, when it is going to overflow. Okay, so such things are also okay. Thank God, light has come. Uh, okay, fine. So then there are hydrocolloid wafers also available. They will help for longer wear, and they also absorb moisture. Okay, so it will keep the area clean and dry. Barrier rings are also available. Okay, so that will help in leakage. Okay, so prevent the peristomal skin excoriation and all. And of course, antimicrobial coatings are also available, which will reduce the risk of infection. Smart ostomy bags, as I told, they come with the sensor and you can see personalized bags. Okay, so outside person will not come to know once it is covered, the bag is covered with this covering. Okay, so it looks beautiful also. Right, so that helps. Order control filters are also coming. Then digital and patient-centric tools are also available. Mobile map apps are there to track the stoma health and supplies also, right? So it becomes easier. Telehealth is of course available for far away patients to consult the healthcare team. And biodegradable ostomy bags are also available for eco-friendly care. Okay, and the internal stoma valves are also available so that the external, it will close also, right? So external appliances may not be required. You have to just open this and the content will come out. Okay, so that type of materials are also available. What is available in our where we are working, we should be aware of it, okay, so that we can train the students and nurses. Personalized fit are also available, as I showed you. A holistic approach is very important, right? And very difficult to identify, right? So talking, that makes a difference. Okay, what kind of difficulties he is having because of cosmetic effects also. Patient may be isolated because of many reasons, right? Uh, some may believe that some evil spirit is there on the family or the patient, and there may be rejection from the family, uh, rejection of family itself from the society, right? Denial, whether it's there or not. So continuous observation and assessment is very much important. Psychological assessment also needs to be done every now and then. Mini my state mental status examination can also be done to identify these psychological problems. Okay, most of the times pre-counseling things help a lot. Okay, then anxiety reduction, how to go about it, right? Identify from non-verbal signs also. Comfort patients' feelings, encourage verbalization. Whatever we saw earlier applies like in all the interventional procedures also. Okay, stay with the patient to promote safety. Tell them that you are always there whenever they need you. Okay, such things, verbalization always help. And as soon as possible, patient should start self-care. That will increase his confidence. Social issues not to be forgotten, denied, impact on spouse, right? Order, leaking order may make meal times very difficult, right? So information should be given. What are the restrictions because of the dressing changes? Isolation is there or not? Feeling of disgust and reversion. Everything we need to. I mean, good IPR. That's what is needed. Where the social support is available, financial supports are also available, right? So where the family requires and whom to approach, right? It may be very small thing like uh, they related to their treatment, say government schemes, which schemes are available, what they can do, right? Uh, from where they can get help, which schemes will apply them, what uh, documents they will require to get such and benefits from government schemes. And of course, the spiritual issues, right? Many of them go away from God. Some of them come near to God because of the disease condition. So identify their, for this also, spiritual gurus are always not uh, needed, right? A small talk with the patient will solve many issues, right? So spend time with the patients. That's the solution. Constant evaluation of the care that is given, right? Documentation is very, very important. Whether the patient is at home or whether he is in the hospital, right? Keen observation from the point of view of nurses. And when we are training students, we have to tell them where they need keen observation, because that is the thing that develops slowly, right? Hygiene of the caregivers are also important. Care of themselves also important, and care of we as nurses when we are working in the such setup, right? Because we don't see all the goody things every day, right? So we need to take care of us also. These are my resources. I'll be sharing the PPT, so you will get it. And thank you very much for patiently listening. So these are some of the take-home messages. Thank you. If any questions, then we can take up.
Dear participants, kindly ask your doubts. So, ma'am, are you showing any videos?
Actually, I know. There are a lot of videos available on YouTube also.
Okay.
So the material which I have given in resources, no, they are also in connection with that also you will find.
Okay. So, dear participants, kindly ask your doubts. Dilip, or else kindly on your camera's video or give feedback to ma'am. So, Miss
Thank you.
Ramila, she's saying excellent presentation, ma'am.
Thank you.
So, any doubts? I think there is no doubts, ma'am. So they are saying thank you. Kirtana ma'am is saying no, ma'am. So, ma'am, thank you for the insightful session. There is one doubt. What should we say if Pat says, "Why I am suffering if I have done so much good?"
A difficult question to answer, right? But many times it may happen that the disease comes on us, right? There is no fixed thing that, okay, uh, I mean, the reason, right? Many a times this is quite why it has occurred to me. Why not others? Right? It is all from God. But it is also there that the God doesn't give us so much difficulties which we cannot face. Right? He gives us difficulties, but we can face them with happily smiling face. Right? So not to lose faith in God is one thing. Very difficult question, I know, to answer.
Yeah, it's more into psychological part.
Psychological, yes.
So, ma'am, I think it's done. So we can wrap up for today. Thank you, ma'am. Thank you for the session.
Thank you. Thank you
And
so much for
yeah,
this chance. Yeah.
thank you, ma'am.